evening, everyone. My name is Dr. Birnhak. I own a medical facility here in Baldwin, right on Grand Avenue, just on the other side of Sunrise Highway, right near the train station. I've been working with the Sanders Law Firm for many years. They do their part. They get you in, they talk to you, they fill out the paperwork, they do everything that they have to do, and then they send you to me, and then I take over, me and the rest of my facility. I'm just going to throw out a couple of names. We have a lot of different doctors in our facility. Our medical director, his name is Stephen Roberts. We have Ahmed Elliman, who's a physiatrist. Stephen Bernstein, acupuncturist. I do all of the chiropractic in the office. Patricia Leantonio is our massage therapist. Dr. Jeffrey Rubin is our psychologist. We also deal with neurologists, orthopedists, radiology groups in the area. We make sure that when you come into the facility that we find out what the problem is. We do an intake, find out all the different issues that you're suffering from, evaluate them correctly, and make sure that you see the correct professional to take care of them. Not only, when you're in an accident, not only do you suffer physical problems, a lot of people suffer emotional problems as well, which is where Dr. Rubin comes into play. Deals with our patients with post-traumatic stress disorders. And when you come into our facility, we have a brand new building, has all of the state-of-the-art medical equipment. We work together as a comprehensive group, like I said, to evaluate the different problems you're having and making sure each professional deals with them in the appropriate manner. Some of our patients just see the medical doctors. Some of the patients see the medical doctor, might see the physical therapist. Some of the patients see the physical therapist and the chiropractor. Some might see the massage therapist and the acupuncturist. Whatever the appropriate combination therapy we feel is appropriate for the patients, we make sure they get. Our job is to get all of that information together, so when someone like Mr. Bernstein goes to trial, he has these nice pictures and can show the jury what the problems were and prove this happened during an accident, and get you awarded what you should be awarded, not the $3,000, but the $550,000. So I've been working with the Sanders Law Firm for over 5 years, and they're very good at doing what they do, and our group is very good at doing what we do. All the doctors and professionals in our group have been working for a very long time. One of the special things about our practice that I think sets us apart from other practices is a lot of different doctor groups similar with combination therapies all in one facility. We have a small office. It's not too big, about 3,000 square feet, but we treat everyone almost like a family member. Similar to Mr. Sanders' law firm, where his wife works there and his children and hopefully one day his grandchildren. I work there. My mother runs the front office. She's a retired accountant, and she's been doing this since I opened the practice. Everyone is greeted, everyone is known by their first name. You're not a number. We know why you're there. We know what your problem is. We know whether you're coming in for an auto accident, a workers' compensation accident, a slip and fall, or any other problem, any other medical problem that you might have. And you're treated that way from the second you get there till the time that you're discharged, and any time after that when you come back in. A lot of our patients, we have reoccurring patients. Maybe they were in a car accident. They came in, they got treated, we made them better, they had a settlement, they finished that accident. Maybe 2 years later, they slip and fell in a supermarket, or they got hurt at work. They call us back up, Dr. Birnhak or Michelle. It's Mr. Smith. Do you remember me? And of course we remember you. I had another accident. This happened, that happened. And everyone is remembered. In our computer, you're not just a number, but you're an actual name, an actual person, an actual patient. And we treat you like that from the beginning all the way through to the end. And that's the biggest difference between our facility and a lot of other facilities that are out there. We have a very friendly atmosphere. When you walk in, of course, there's a waiting room, and you're attended to there. Once you go in through the back, we have big open area, a room filled with physical therapy equipment, curtains with tables. There are private offices as well, because some patients like their privacy. But everyone is together. People talk. We have different groups that come in at different time. We have our Medicare group that comes in the morning, and they all sit down together, and they get on the bike or the treadmill or the elliptical machine, and they talk about their different problems that they have. And then we have a different group of people that come in after them, our post-work people. Our office, 3 nights a week, we're open until 8 o'clock at night. Like I said, we're very convenient right off the train, which helps very much someone that's going to work. Come right off the train and walk right to our facility. We have parking right behind our facility. I know parking on Grand Avenue is very tough, but we have our own parking lot right behind us. So I'm going to keep this short. I'll be here afterwards if you have any questions, concerns, any medical problems, any medical questions that you have. My card and a pamphlet is in the booklet. There's some cards on some of the different professionals that we have there in the office. I included each of the different cards, but I'll let you get back to eating. I think Jonathan Klee is going to come up and talk a little bit about workers' compensation. And I've worked with Jonathan before. He's an excellent workers' comp attorney. And enjoy your evening. If I could ever be of any help, any medical problems that you might have, please give us a call, and we'll treat you like one of the family. So thank you very much. Have a good evening.